Welcome everyone. We are the team Striking Stormers from VIT Chennai. We have chosen the theme of improving the workflow of hospitals. Radiology technologists have the daily challenge of achieving the best quality first time right scans. There are many manual tasks involved in this flow that consume a lot of time and chances of mistakes and retake of image is likely. Our main idea is to automate the manual X-ray workflow which saves time during the exam process. AI-based features can help the radiographers get the correct positioning of the patient, adjust the collimation area and get the correct exposure settings according to the patient's size. This helps us in faster screening of patients and decreased wait time. Let us consider the scenario how a chest PA image is acquired in the current workflow. First, the patient is made to stand in an upright position. According to the patient height, the clinician adjusts the detector and the X-ray source. Clinician manually finds the T7 vertebrae bone. Then the IR is aligned to the T7 bone and the clinician proceeds towards adjusting the collimation area. Next, the exposure factors like KVP, MAS are set by the clinician. The clinician should be careful while setting exposure factors. If a film is overpenetrated, that means everything will appear very dark and can mimic abnormalities like pneumothorax. On the other hand, if a film is underpenetrated, then everything will look very white. Even a small degree of rotation will distort the image and it may even mimic an abnormality like mass. This may cause a retake of image which could cause the patient for more exposure. As we discussed in the scenario, we get to know that there were lots of manual tasks involved. We propose 4 features to automate this workflow. First, intelligent patient positioning. Using this posture estimation, we can provide an augmented live patient view that indicates the detector boundary along with the patient position and post verification. After that, the radiographer can provide guidance to the patient on needed adjustments and automatically moves the wall stand and the tube head. This reduces the need for physical contact between the radiographer and the patient. Next, the intelligent collimation. This adjusts the collimator in accordance with the detector height and detector width of the patient in front of the wall. Intelligent exposure technique. This automatically detects the patient size to apply an appropriate APR setting based on the exposure chart. According to the body habitus of the patient, we can refer the exposure chart for correct KVP and MAS. Rotation check. We check for the rotation in X-ray image by ensuring that the right shoulder point and the left shoulder point are equidistant from the mid-sagittal plane with help of OpenCV. The tools and technologies we have used are first the MediaPipe library for posture estimation, then OpenCV for video processing and distance measurement, next SciPy and IMUtils for distance approximation, MySQL for database management and PyQt5 for the GUI application. Project is like this. First, we enter the patient details and then which part of the body is to be examined, and then the patient automatic setup is done. Once it is done, we estimate the posture and verify the posture of patient. The collimation and exposure settings are adjusted automatically with the help of posture estimation and verification and also the distance measurement techniques. Once all these are done, we provide an augmented view of the patient. Everything is correct, the X-ray image is acquired. After finishing this process, we also record the patient and physician conversation and generate it as a report which can further be printed and submitted to the doctor. Now we look at the methodology to solve this problem in the manual workflow. Posture estimation. We have used the MediaPipe library for posture estimation which predicts 17 key points in the human body like the shoulder points, the hip points, the wrist points, etc. Next here is the distance measurement by OpenCV. With the help of this technique, we can measure distances between any 2 points or objects in an image or video in centimeter, feet or inches. To achieve this, we use a reference object of known dimensions. Based on the ground study of 6 scans we surveyed at Gemini scans at Ambattur, we realized that patients get very tensed at the X-ray room, which makes the task difficult for the physician. Some of the X-rays require certain postures to be maintained by the patient. As the patients are nervous, they can't able to understand and respond to the physician's call. So we propose a solution like this. First, we explain the scan to be performed to the patient with a step-by-step explanation video. Next, we will estimate the patient posture real time using posture estimation by MediaPipe. Compare this against the known position to provide the patient with visual feedback. Talking about the scalability, we have currently developed the application for chest PA and scapula AP examination. Further, we can extend this to various other anatomies